So good day, lovely viewers. I'm super excited to bring you another edition of Kids Corner. I'm Dr. Z and this is Kids Corner. As we always do, we educate, we inspire, we inform you on any and everything about the health, the care and safety of kids. And thanks for joining us. If you've been with us for some time, you know that a few months ago, we had a discussion on child safety and protection, where we discussed the role of the society. Today, we are going with the second episode of child safety. We are talking about domestic safety. We are coming home. We're talking about domestic safety. And we have with us another important guest of honor. She is a pediatric resident at the Kamfanichi Teaching Hospital. She is a mother of so many children. She's a wife of a superman. She is in the person of Dr. Emma Sawatri. Doc, you're welcome.
Thank you very much.
And thank you so much for accepting my invitation to the show.
Welcome.
I really appreciate you coming. So please don't benefit from the discussions we'll have here alone. Make sure you share, you like, and you leave a comment. Let me set a precedence before we actually set the ball rolling. So some studies have actually shown that accidents in the home is a major cause of disability among children, to some extent death, and globally accounts for up to about 13.5% among children under the age of 5. In a similar study conducted in Ghana, precisely in Kumasi, they found out that 600 out of 1,000 children every year actually suffer the effects of accidents at home. And interestingly, most common among these accidents are burns, falls, and then poisons. Funny enough, males are actually more affected than females, and it's expected because males tend to take more risk, are more curious than the female gender. They also found out that the kids of the employed are more affected than the unemployed, and it's also understandable because, of course, the unemployed tend to have more time to supervise their kids, and so it kind of makes sense. So this sort of emphasizes the need for this discussion on domestic safety. I wouldn't waste your time. Let's set the ball rolling. Doc, let's talk about burns. So working with the child health department, I had the opportunity to manage a few kids who unfortunately or sadly got burns. I know that there are different kinds of burns. What are the most common types of burns you usually observe, and what things predisposes these kids to these forms of burns?
Okay. So thank you very much for having me on your program. It's very important, like you said, some of these injuries that happen in the house. And talking about burns is one of the common accidents children present to at the emergency. The type of burns we mostly see are burns from scald injury. That's hot liquids, mostly boiling water and steam. So this is one of the major causes of burns in the pediatric population for those who present. And looking at the home, obviously it's due to our poor supervision of children. And it's mostly children, especially the younger children, who crawl around and stumble on the hot pot of soup or water, which tumble over them. And also sometimes during bath, a mother takes hot water and is now going to fetch cold water. Meanwhile, the child is just by the bucket. And children, they are kids. They go anywhere, want to touch anything, and they may just tumble the bucket over and injure themselves with the hot water. So scald injuries are the very common types of burns we see in our children, the pediatric population.
Interesting. So there are times that you'd have a mother put a kettle down and say, I'm picking something, maybe and this child crawls to it and then attempts pushing it, and what happens. It's sad. But what should a parent do when a child gets burnt? Immediately, first aid.
So immediately when a child gets burned in the house from scalp injury or whatever, the first thing is that you want to take the child away from what the source.
Okay.
So sometimes the child may have fallen into a pot of soup or even poured on the floor. So the first thing is to remove the child from where the harm is done. Then also it's burnt, so you want to cool the surface that is being burnt. So in this case, you are not going to use hot water, ice water, because it burns. People want to like counteract it, but you just have to use cold water.
Okay.
Cool water. Yes. So normal pipe
Tap water.
So
running water
to just wash the place of the burn.
Okay.
That's the first thing. Then another first aid you can do whilst you prepare to bring the child to the hospital is to, after you've washed with tap water, you can apply a soothing ointment. Usually we prefer aloe, because it has a soothing effect to reduce also the pain, and also when you have burns, the place is dried up.
Okay.
Yes, so you want to use a lotion. It will also help moisturize the place. Yes, so to then after you've used the lotion, you also want to cover the place with a clean cloth. Yes, so that, because you want to prevent infection, that is not the time to mash herbs to apply, because in that case you are actually predisposing the child to get an infection. So the first aid you can give is to use water to wash the place, then cover the place with a clean cloth, then you can subsequently bring the child to the hospital.
So when you mentioned herbs, that my mind went back to a certain child I saw at Komfanochi. This child also had experienced or got burnt, I think on the hand and then the thigh. And then what happened was that a mother tried applying some herbs, some preparations at the site. I think there was no money. Mother was financially handicapped, and so tried to manage the child at home. Unfortunately, this got complicated, and then child developed what we call sepsis. And by the time the mother brought the child to the hospital, there was what we call overwhelming sepsis, and almost all the organs had been affected, and eventually we lost the child. So that's how bad it can get. So that brings me to my next question. At what point is it every burns that requires you sending your child to the hospital? At what point do you need to do that?
Yeah, so there are different types of burns. We have the first degree, second degree. The second degree, we have if you look at the skin, there are layers. I'll just try to keep it as simple as possible. Yeah. So you have the epidermis, that's the very topmost layer. You have the dermis, which is like the second layer. Then you have where your subcutaneous tissues are. You have your blood vessels, then you come to muscle, then bone when you are going deep down. Okay. So usually the first degree burn just involves the epidermis, that's the surface. So if you have a burn that is superficial, that involves just the epidermis, you would ask, how would you know it's even superficial? But with that, you realize that it's usually just change in skin, probably reddening around the place, and maybe some little blisters that may form. You understand? But if it's deep burn, you realize that the skin change is more prominent. It's more darker. It's sometimes the blisters are more pronounced. Yes. So sometimes the third degree and fourth degree is difficult to. As a parent, you might not be able to tell, but with the fourth degree, where it's gone to your dermis, subcutaneous, and even your muscle and bone, you realize that the whole place is burnt off. It's charred. That's what we call charred. Yes, but usually, if you have a minor burn, what we say minor, maybe involves a lesser surface area. So what you can use to estimate is the palm of the child. not your palm. So if the burn is less than the palm of the child, which is estimated to be maybe less than 8 centimeters, you know that it might be a minor burn. So that you can actually manage in the house.
Okay.
But even with that, you have to observe the child. You know that it may be a minor burn, but if it's not well managed, once it gets infected, it may come with, like you said, sepsis. You can go into septic shock. Yes. But if you even have burns at certain places, because of the function, especially if you have burns in your palm and your feet around the joint, even if it's a small way, you have to bring the child to the hospital, because there's a place where if it's not managed well, you may lose certain function. Over the joint, you may even form contractures, which would predispose the child to disability in the future. So at certain areas, if you have burns, you still have to come to the hospital.
Okay. So I think you're saying that with the first degree, the superficial burns, if it's just blister, you can run cold water over it and then apply a Vaseline or aloe or something.
Lotion
to
soothe
over it.
it.
But you still have to observe. But
Yeah.
then when the skin is ripped off,
You have
to
to-
go to the hospital.
yes.
So I think please let's take note of this. It's very important.
And also to note the diameter, because if it's also greater than the palm of the child and it's even like a superficial, you still have to come.
So what can parents do to mitigate some of these things, prevent their kids from suffering the effect of burns?
So the key thing is supervision. And we always have to, we should understand that children are children. They don't know that this is hot water, this is hot soup, this is going to harm me. So as much as possible, let us keep these hot things out of their reach.
Okay.
So if you're going to bath a child with hot water, you've poured your water from the kettle, make sure you dilute it with cold water, even before you bring it to where the child is. If you are preparing soup, you don't let your child play around knowing that, okay, I'm just sitting here and he's playing. Sometimes you may have to go and pick something from the kitchen and you forget that the child is there. So we have to make sure that we keep them out of harm's way. So wherever these hot liquids are, you keep them from that. And I also wanted to add with that, our children with one of the causes of these burns are children who have epilepsy. Sometimes you don't know when it's going to come and they just have a fit and they may just fall into a hot liquid or something. So you also be conscious that you don't let these children play around where the hot stuff are. Yes.
All right. And another thing is, I think iron.
Yeah.
Iron, where we position iron, make sure that it's off and far away from their reach as possible. Now let's move on to the second. Let's talk about falls. In what ways are children predisposed to falls and its effects?
Yes. So, kids, I think for falls, when we talk about kids, we're also talking about adolescents. So, like you said, most of our adolescents are very adventurous, climbing things. So I'll start from them and I'll come to our younger children. So we've had cases where children climb up to a tree to pluck mangoes and they fall. It's accidental, but they fall from height from a tree or they climb walls. Kids, they want to climb anything that's they are able to climb, then they may slip and fall. So that's one of the ways children sustain fall injuries. Also, for the younger kids, we put them at heights. We can have a chair that is very high. That's where we feed the child, or we can even pick the child and put on a table to play with and just forget ourselves and they fall over. So these are some of the things that happen and we have falls in the children.
That's great. I think also slippery floors.
Yes.
So when we forget, we are mopping the house and then we forget that the place is what's the name? There's water on the floor.
Yeah.
These
Especially
kids,
the tiled
the
surfaces.
tiled surfaces. And so as much as possible, we should try to block the site or prevent these kids from having access to such.
And sometimes with how our buildings are designed, Like maybe the child is with the parents on the top floor and the staircase, and these children, in a bit to climb down, may just topple over and fall.
Yeah.
So at least, I know we get to the prevention bit, but there are ways to secure some of these things, to get gates, yes, to barricades, yes, to help. And there are even some buildings that there's a staircase and there's no rail to actually block the child. So kids are just climbing up and down. You can just topple over and fall.
Now, I see a lot of parents, they have kids fall and they go like, oh, it's normal. And kids are collabing out of one. Like, is there any effects of fall or a fall on a child?
Yes, definitely. And for every trauma case, you know that the force of impact will determine like the severity of injury. So sometimes it may just be a minor fall, but with higher heights, when there is a fall, the child is at risk of head injury. You can, or even fractures, depending on where you land. Because I mean, if you land on your arm, on your leg, you may actually sustain a fracture or even a dislocation.
Okay.
If you land on your neck, you can have a neck injury. If you land on your head, you can have a head injury. And that's what sometimes it's very scary, because if you know that some of these head injuries, frankly, you may have loss of consciousness, or the child may have a seizure that will prompt you, but you know that some are delayed.
Yeah.
The child will fall and get up, but I mean, whatever hemorrhage is going on in the head is still ongoing till it gets to a point that he now begins to realize the child is just sleeping too much. It's difficult to even wake up the child. The child is having seizures or there's altered consciousness. Then that prompts you to know that there's something more to it. Maybe this child has a head injury.
So you're already talking about the pointers. I was actually coming there. What would prompt a parent that my child is having a complication or an effect from the fall?
Yeah, so like I said, for head injuries, some of them immediately there'll be loss of consciousness. So obviously you have to immediately rush the child to the hospital. For some, there'll be subsequently having headaches, vomiting early morning. Then you know that this means there's some signs of raised ICP. That means the raised intracranial pressure, or they start having seizures. They start exhibiting some sometimes some abnormal behaviors. They are sleeping, they are just drowsy, they want to sleep all the time. It's difficult waking them up. These are pointers that you have to send the child to the hospital. Or you notice that there is a swelling, or the child is now limping. I mean, the child was well, but after that fall, child was complaining of pain in a part of the body, now is unable to bear weight, there's swelling over that place. Then that would prompt you to seek for medical attention, as there could be any injuries.
Also look out for limited mobility. So if the child was moving the hands or the limbs normally and all of a sudden is using one more than the other, then you should be concerned. You usually see or hear parents say that, I mean, I've experienced that a lot of times. They say that, oh, you're kwachiche nensano. Is it actually the right thing to do? Because of course I know a lot of people believe in that.
No. You know that there are different, when it comes to kids, you know, you still need to function. You need your hands, you need your legs, you understand? So if there is a fracture, even depending on where the fracture is, the management is different. If it's closer to a joint, around the joint, is a different thing, because if it's not well managed, then you're developing contractures. When I mean contractures, stiffening. So now you can't fully extend or fully flex your limb, and that is you having a disability.
All right.
But this could have been salvaged if you had come to the hospital and was well managed. So I would never agree to the traditional bone setters. Because some of these fractures are even open fractures that they are wound. We have to manage with antibiotic and make sure that there is good healing process. But they'll just do herbal, and in the end, the child just loses their limb, because they develop a complication, osteomyelitis. You have to take the bone out.
Interesting.
So it's a no-no.
Okay. So lots and lots of insightful discussions going on here. Please don't forget to like and then leave your comments. Ask all your questions. We'll have them answered for you. Let's move on to the next. I think let's talk about choking. Choking. I've heard instances where, of course, I know it usually occurs when we are feeding. I mean, how does it occur that someone is just eating and the person chokes?
So you know that when you look at the airway, let's say when you look at your mouth, you know you have your trachea, that's where you are breathing in, your esophagus too, it's where food would pass. And how God made us, there's a covering over the trachea, what we call the epiglottis. So usually when you are feeding, it forms as a flap over the trachea, such that the food doesn't go to the trachea, but it's able to go through your esophagus, like it's
your food pipe.
Your food pipe, yes, let me just say your food pipe, so that it spares your airway.
Okay.
But sometimes when you are eating and talking at the same time, singing, it's like, because you also need your air to pass over your voice box to make sound. So if you are talking, you are eating, then now food can easily go into the trachea where food isn't supposed to go there, it's just air. So that's how it happens. And also you realize this force feeding in infants, neonates, the child is crying, the mother wants to feed porridge and the child is crying, and we are pushing the porridge, he's vomiting, he's coughing, and we are still force feeding. We end up pushing the food over the trachea, into the trachea, then the child aspirates. So the food that's supposed to get into the stomach now gets into the lungs and bring a lot of complication, aspiration, pneumonia, which could be very bad. And I think recently a child died from this force feed, and I think outside, which was reported, one nanny was force feeding. I mean, the intention wasn't to kill the child, but you know, that's how things happen, accidents happen. So these are one of the means the little ones get choked. And also, you know, they are putting, especially the age 3 to 4 years, they are just mouthing everything, they are putting it in their mouth. So some of these little food stuff like beans, peas, those are very little, so can just easily slip into the trachea and cause obstruction, what we call airway obstruction. Then now getting in oxygen that's supposed to go to your brain, supposed to go to all parts of the body, is stopped because you are not getting enough oxygen because of the obstruction. And these children come with so many complications from that airway obstruction, getting hypoxic brain injury.
I wonder if they understand that. So that's
okay, but I mean
oxygen.
Your brain being starved of oxygen and come with so many complications, and they end up with disabilities.
Okay.
Yes, so
I think another thing too is when we are giving medications to children, we tend to hold
their nose and lock their jaw
and try to force it, and you end up getting the whatever it is into the lungs, and trust me, you wouldn't like it. You wouldn't like it. I've had very terrible experiences with that. So.
And I must also say that some children, due to certain underlying conditions, are at risk of choking. Yes. But most of these things can be prevented if, even for those children, they are fed well, fed in an upright position. But the things that we can prevent, the force feeding, children talking whilst feeding, all these are bad practices.
So moving, talking, or making any activity.
They are jumping and shouting whilst eating all these things.
It's not a good habit. Let's make sure that they get seated, sit upright, not lying down. Mommy, give me the drink. I want to sleep small. And they are lying down and they're feeding. Can cause choking. So of course that's the prevention or the preventive part. So how does a parent know that my child is choking?
So you realize that with choking, these are children who are not sick. These are very well children. This child was just playing, and all of a sudden, it's just sudden, the child can't breathe, stops talking, and usually they typically hold their neck because like there's so much discomfort. It's like their hungry for air. Yes.
Yeah.
So, and it's just sudden. There's a well child, there's no fever, no cough, child who was probably, and mostly they are feeding.
Okay.
Or they are just playing with these small objects that they can easily aspirate, and all of a sudden the child can't breathe, stops talking, and it's like they're trying to, for older children, they can try to cough it out. Yeah, but for the younger ones who can't cough, it's like they are just gasping for air. Yeah.
So when it happens, what should the parents do?
So immediately, first, the parents you have to remain calm, because you also have to perform some skills that can help. So for older children, there's certain maneuvers you can do, because most of the time the object is stuck in the trachea and the airway. So you just have to perform some maneuvers to force it out. So the first one that can be done is what we call the back parts. So
that's for the infants.
Yeah, infants, and even for the older children, you can do it. So in between the shoulder blade, you use the palm of your hand to firmly hit. What it does is that it's like you're causing some vibration in the tube, which is supposed to force the object out. So usually do it about 5 times. So there's an infant, so just pardon me. Usually for them, you just do a pat at their back, but for demonstration's sake, for the older children, you pat their back between the shoulder blades. You do it 5 times. If there's no improvement or the object isn't out, what you can do is what we call the Helmich maneuver. What we do is that you place your fist, your right fist, just below the sternum, so a little above the navel of the child. I'm sure we all know the navel of the child, yes. So you put the umbilicus, or what we all call the navel, just above it. You put your right fist there. Then with your left, standing at the back of the child, with your left hand, you thrust. That's what you push it inwards and upwards. So it's like a firm thrust. What you are doing is that you are forcing you're forcing air out of the lungs, and in doing that, it would force the object out. So you also do that firm thrust 5 times, whilst you're calling for help or calling an ambulance or preparing to get the child to the hospital immediately. So these are some of the things that you can do, starting with the back part, you hitting the back in between the shoulder blades. You just go directly there firmly. Do about 5. If the object isn't out, then you perform the Helmich maneuver for the older children. For infants, those less than a year, like this child, instead of their abdomen is so small, so you can't do the Helmich maneuver. So what you do is that in their sternum, with their head a bit tilted down, so in between the nipple, I should say, yes. Okay, so over the middle.
The bone at the middle.
Yes. Okay, so like the midline, that's easier. You just press firmly. That same like the upward inward thrust you do the same thing on the child's sternum. Okay. To the same way to cause that vibration in the trachea to move the objects out. So you do that 5 times. But if it's still unsuccessful, there's a time you should be preparing to bring the child immediately to the hospital, where the child can be managed and we can take the objects out in time. Because any more time you waste, you are starving the child of oxygen.
Yeah, and can just cause death.
Yeah.
Yes. So please let's take notes, please. I'm learning a lot. I'm sure you are learning a lot too. So don't learn this thing alone. I mean, share, and let others chance on this video and then learn a lot from our discussions here. Let's talk about foreign body in the ear. I know that kids like to explore. They want to know how it feels like to put things in their ear. So Of course, when I find a needle, or even a needle is painful, a button or something small, I want to just see how it feels like. Okay, and let me just try and put it in my ear or my nose. I even have a nose. I forgot I even have a nose. Okay, so let me just try and put it inside and see how it feels like. How does it feel like having that object? And the thing gets stuck there. So what should you do as a parent? I know that instinctively what you will do is try to get the thing out, because of course, hey, I did a question, so you take a pen, then you try to scoop it out. But is that the right thing to do? What should we do?
No, that is not the right thing to do. So if you notice that a child has accidentally put an object in the ear or in the nose, what you have to do is that that is not the time you are going to take it out, because sometimes in our eagerness to take it out, we even push it further and cause more harm. Or we stick in sharp objects, especially in the ear, and even perforate the tympanic membrane, or like the covering in the ear. So whenever a child accidentally inserts an object into the nose or the ears, you have to bring the child to the hospital. I wouldn't advise that you manage it in the house. Yes, because in doing that, even sometimes what the instruments they use in the house, we end up causing more harm. Yes, and sometimes you might not even know that the child may have put something, but there are certain pointers you realize that now the child, especially for the objects they put in the nose, they start having very offensive nasal discharges, having halitosis, because that object will just be a breeding ground for organisms, infection, bacteria. So they have all these discharges, or even from the ears. Okay. You understand? So you have to bring the child there, where sometimes we even have to wash it out of the house, or use equipment where we look at where the object is and directly take it out. So it's like direct visualization. You are looking at what you are taking it out. But in the house, you may not even see it well. So you are just blindly scooping, and you may end up causing more harm. So for these foreign objects, you have to come to the hospital and we'll take it out.
Sure. So please, let's take note of this. And don't try to get the things out of their nostrils. If it's a foam or a cotton wool, whatever it is, just quickly rush the child to the hospital. We use the right tools, and a forceps or whatever, to get it out under direct visualization. Let's take note. Let's talk about cuts. The same way children like to explore, and so they see, let's say, a blade, then they take it, try to play with it, and they are cut by the blade. Or sometimes it's just the sharp edges of tables, metallic tables, barricades, doors, and what have you. So when a child is cut, what should the parents do?
So when a child has a cut, the first thing is to clean the cut. So you'll sometimes, because based on where the cut is from, all these places you mentioned, some of them are not even clean. Yeah. So the first thing is to wash the wherever the cut is. Then for some of them, it's just minor cuts. It's not, after cleaning, washing it with a bit of soap and water, there's no active bleeding, the bleeding has stopped, it's just a minor cut. Then you may treat it in the house with a GV paint. Yes, but some cuts are major, especially from these nails and broken bottles. These cuts, you have to bring the child to a hospital. Because sometimes we even have to assess the child's, look at the child's immunization. Some children would have to receive prophylaxis, be immunized for tetanus. Yes. And some cuts are deep that may require to suture them. Yeah. Because of how deep it is, or like the amount of bleeding coming, you can't just stop the bleeding. So these ones will have to come to the hospital. So that we attend to them. So if it's a minor cut, it depends on the cut, it depends on the equipment. If it's a clean, like you're saying, if it's a clean blade, a minor cut, you may just manage in the house. But whenever you see all these things you manage in the house, it's not just you manage and you leave the child. You have to observe it.
Observation.
Because sometimes it may start with just a minor cut, but because it's not treated well, it becomes infected. Then it comes with a whole lot of problems. So once you manage, these are first aid. You do it, you observe. If you realize that is not, your intervention is not enough or it's worsening, you have to come to the hospital. But there are certain cuts that, if it's a deep cut or it's from these objects, broken bottles, that has been on the floor for a long time, these nails, you have to come to the hospital so that we assess the child, and if the child needs prophylaxis, we give the child.
Wow. But since a cut sort of bleaches the skin and exposes the body to microorganisms in the skin outside, would you say that parents should go ahead and then do antibiotics?
No.
Why not?
You see, you have to assess. There's a break in skin, all right, but it's not every cut that requires an antibiotic. You should know that we also, parents should know that we are battling with antibiotic resistance. So it's not every, there's a cut, and the first thing the mother thinks, okay, let me go and buy Augmentin and I'll treat Flagyl. No. Right. You just don't start antibiotic without any basis. That is why, if you're worried, bring the child to the hospital. Yeah. Yes. Then we'll take care of the child, because sometimes even the antibiotic that you are given, because you don't probably understand the science behind it, the type of cuts, the things involved, the antibiotic may probably not be doing anything for the child. So you have to come to the hospital, and the hospital isn't a scary place. Like, people, when you talk about the hospital, it's like they would rather manage the child in the house, or like sometimes over the counter. But sometimes when you come to the hospital, let me say, in fact, it's not sometimes, most of the time, that's where the children get the best of care. You understand? So for these cuts, we have to bring the child. But the first thing is that, it all comes back to the supervision. We always have to keep these harmful things out of the child's reach. You go to a house and there's a blade lying on the floor.
No one is concerned.
There's a knife just in the reach of the child. Yeah. I mean, as parents, we have a lot of responsibility to protect our child. So take all these harmful, sometimes even the toys they play with are even harmful objects, because it may have this sharp pointing cuts. Yes, that can easily cut. So we have to pay attention to all these things to protect our children.
Insightful. We're actually drawing near, coming close to the end of the show. Let's talk about bites. I know that you've worked in the pediatric emergency unit. What are the common organisms that are implicated when it comes to biting kids?
Yes, so for biting kids, it's sad, but we have a lot of snake bites.
Wow.
Yes, a lot of snake bites, and there are also some dog bites, some, for the older children, some human bites too, people are fighting and
they bite.
Yes.
Oh.
So these are, but most commonly is the snake bites.
Oh, okay.
Yes, and also, scorpions sting here and there, yes.
How about snakes? I thought they live in the forest, so how do they get entry to our homes?
Yes, snakes live in the forest, but that sometimes, by virtue of how our environment is, there are these trees, there are weeds around, and snakes will want to hide in the grass. So, and these are where the children go out to play in the field, sometimes at night, and just feel something on their foot. They'll just flip it away and notice that, okay, there are these spots on the leg. Yeah. So snake bites are the commonest I've seen as the, yeah.
Okay, interesting. So how do I distinguish between a snake bite or the bite or a sting of a scorpion or a dog from, let's say, a cat, a plain cat?
So all these animals have different dentition. So, for the snake bites, depending on the type of snake, some and their manifestation, some will just cause local envenomation. So, the swelling of the affected place. Some would be hemorrhagic bleeding. Some are neurotoxic, so intense pain. So some based on some of these manifestations, then you know that okay, it's this group of or this type of snake that does the hemorrhagic. So there's a snake, yeah. But I know some of them, dogs. Sometimes it's usually based from the history.
Okay.
That's the child,
So
you know that okay, there's a type of bite, and they are all managed different. Even for snake bites, they are not all managed the same way. Because, like I said, there are some that are hemorrhagic, their manifestation is more hemorrhagic, that's more bleeding. Others are neuropathic, more pain and paresthesias. Some are
numbness. Paresthesias is numbness.
Yeah. Local envenomation, so more cytotoxic. There's edema,
destroys the cells around, so it becomes swollen and looks like there's some.
So you see, a child can't have a snake bite and say you are going to manage in the house or using herbs, because there are different manifestations. If the child is bleeding, this child would require blood. This child will require that we give anti-snake venom to counteract the effect of the venom. Okay. You understand? So all these will have to come to the hospital.
So are the manifestations immediate, or some can occur?
So, it's not all of it that is immediate. Sometimes the local envenomation, you would see it, but sometimes it will take a while. Okay. Then subsequently you realize that he's bleeding profusely from that side, and now bleeding from everywhere, the mouth, the nose, ears, he's just bleeding from any single, even sometimes old wounds that you think are almost healed will also start bleeding.
I know, right? Yeah.
So because of these reasons, that's why you can't manage
these
bites at home or even with herbalists. You understand? Yes.
So I'm a parent, my child has a bite or has been bitten. What do I do? Send the child to the hospital. So
what you can do immediately, there's always something you can do before, whilst you are preparing, because you have to probably get a car to bring. So whilst preparing, what you can do is to always wash the place of the bite and also cover it with a clean cloth. If it's bleeding and you have a clean cloth, you can apply firm pressure to where the bleed is. We do not encourage tying, like forming a tourniquet at the proximal to where the injury is. So
tying the upper part.
Yes, to prevent that's what I mean by proximal. So you just have to apply firm pressure. Wherever there's a bleed, when you apply firm, steady pressure, it is able to control the bleed. So all you need is to apply firm pressure. Yes. Then bring the child to the hospital.
Are there any things they are expected to do in terms of when they are coming to the hospital? Any things that we as doctors expect of our parents?
So if we could get someone who was around to give us a good history, sometimes people kill the snake and bring it, but we realize that wastes time going to chase after the snake to kill it. If immediately they did kill the snake, but it's not that normal that you have to bring the snake to the hospital. All we need is for you to bring the child to the hospital as early. You first wash the affected side, apply firm compress or clean cloth, and that sometimes the pain is too much, so you can start with an analgesic, given paracetamol. Yes, then you bring the child.
They should also bring the snake to the hospital, or they should.
Well, that's what I'm saying. If you know the type of snake, sometimes it will help you, but I'm careful in saying that because some people be so obsessed in killing the snake to come to the hospital that they delay bringing the child to the hospital. Yeah. So that is not the priority. The priority is to get the child immediately to the hospital, and not to follow the snake to go and kill the snake to bring to the hospital.
Okay.
Only that sometimes if we know the type of snake is, it helps us, like we said, some of the manifestations are not immediate. So if we know the type of snake, then we can anticipate that, okay, this is part of the group of snakes that does the neurotoxic manifestation, or this is the type of snake that would do cytotoxic or hemorrhagic. But it is not the priority to get the snakes to the hospital. The priority is to get the child, so that, it's not every snake, most of our bites are non-poisonous snakes. So sometimes we just have to observe the child for these. If we come, we observe the child, the edema isn't worsening, there are no bleeding, no other signs of envenomation, systemic signs, then we can discharge the child after observation for 24 to 48 hours. Then the child goes home, because most of the manifestations are not immediate.
All right. Wow. I've learned a lot. A big thank you again to Dr. Emma Sawache. I appreciate you coming. So I've learned a lot personally from these insightful and interesting discussions. I hope you would also learn something and then apply them wherever you find yourself. Share these nuggets of knowledge with other people, other parents. Let them also benefit from what we've discussed here. Another big thank you to you for sticking and staying with us all through till the end. And to my crew, Ima and the rest, God richly bless you. Till we meet again, stay blessed. Bye-bye.
Bye.